We've got Leeds Beckett up today. We in Public Health Reform have really been learning a lot from the work that they've been doing in England with Public Health England and Local Government Association. And although I guess a lot of that work has focused on childhood obesity, in Reform we really think that we can take that whole systems approach to public health challenges and apply it across our public health priorities. So I know there are people in the room who aren't working in and around diet and healthy weight as well, so I'm hoping there'll be a lot for you to learn, even if the example that we're working with today is focused on obesity. But the aim of this morning is, so I've been working on Reform for about 6 months now, and when I've been out talking to people about systems change and systems approaches, I've been picking up quite a bit of anxiety from colleagues who've been working in and around public health and health improvement for a long time, who feel like this is a shiny new approach and it feels a bit impenetrable to them. So there's a bit of anxiety about who's going to train us up in taking this approach on and being able to implement it in our local partnerships. And what I hope today will do is a bit of demystifying the bit around systems and complexity, because I think, now that I've done a lot more reading in it, that actually we who work in and around public health and health improvement in Scotland have got a lot of the core skills that should allow you, without, quite quickly to start picking up some of these tools and techniques and using it to strengthen your work that you're involved in anyway. So I hope you leave today with a sense of, okay, I kind of understand that now and I feel more confident to go and look at the Leeds Beckett toolkit that they've produced for Public Health England, or look at some of the other resources that Public Health Reform has started to signpost people towards, and more importantly just to have the confidence to just start trying it out in your work. It's not going to be perfect, it's a bit messy, but the whole point is about trying to get us to start talking to a wider network of people to strengthen the partnerships we already have across Scotland. So I hope you leave with that kind of sense of like, okay, this makes a bit more sense to me now, I'm going to go and give it a go. So my job is then just to do a bit of scene setting. So just a bit of an update on Reform and why this fits within Public Health Reform. A little bit of an update on the policy context around diet and healthy weight. Now I don't work in and around diet and healthy weight, so I've borrowed slides from Mel Weldon, who's the policy lead in government, who couldn't be here this morning. And then a little bit about the whole system approach and how that fits within Reform, and then pass over to Joanna and Duncan from Leeds Beckett to talk a bit about their experience working in England with local government. And then more importantly then we're going to do some kind of workshop style learning around applying systems thinking. So Public Health Reform then. So why did we need Public Health Reform in Scotland? Now this will be familiar to most of us. We have got quite a public health challenge in Scotland. So across Western Europe, Scotland has the lowest life expectancy, and within the UK we've got the lowest life expectancy of the 4 nations as well. And what underpins this is these kind of persistent inequalities in life expectancy. So still in Scotland there's about a 10-year gap in life expectancy for people who are born in our most deprived communities compared to those in the least deprived communities. And if you look a bit closer at that and you start looking at healthy life expectancy, which is the years that anyone who's born is expected to live in good health, so with no health complications, that gap actually widens to 20 years between those born in our most deprived communities and least deprived communities. And on top of that, so that's a bit of the overarching challenge. So although if you take a long look back through history, everyone's health has improved generally over the last 100, 200 years, but it's not been improving fast enough and not equally enough for everyone in across our communities. We've also, like other countries in the UK and Western Europe, our population is changing. It's becoming much more complex in terms of the health and social care needs of our communities. And we know that a focus on prevention is important if we're going to really start to better meet the needs of our communities. And importantly for public health, we recognise that healthcare provision is not the main determinant of our health. In fact, social and economic conditions are equally, if not more important. So, Public Health Reform then. So I wanted to maybe just pick up, before I talk about what Reform is about, just talk a little bit about why the Public Health Review, which was published in 2015, and some of the themes that kind of picked out, So it said that there was a lack of clear priorities across the country, both nationally and locally, on what the public health community should be focusing on if we're going to have an impact on reducing inequalities and improving health. It talked about a real disconnect and lack of coordination between the national public health endeavour and local efforts. And it also talked about that there was this tension about where the workforce was spending most of its time, and so much less consistently spending time looking at these kind of the big drivers of health and health inequalities, so the social, economic and environmental factors, and much more focused in on the kind of improving healthcare and access to healthcare and individual behaviour type interventions. And so in response to that, public health reform was tasked with kind of 3 deliverables. So the first was to co-produce a set of national public health priorities, and they were, after extensive engagement locally and nationally, they were published last year, and there are 6 of them, and I hope they're familiar to all of us. The second task was to declutter that national landscape, because local partners were saying really clearly they didn't know who they needed to go to when they needed support, because there were different bits of public health sitting across different national agencies. And so Public Health Scotland will bring together those disparate parts of the national public health workforce, and will be vested in April next year. No more delays, I promise, definitely coming. And the final ask then was this focus on strengthening the collaborative efforts. Now it says here at the local level, and that's what it says in the delivery plan, but over the last 2 years we really recognise that it's not just about focusing on local partnerships and asking them to strengthen their collective efforts for public health, but it's about how we strengthen the connections between the national efforts and the local as well. So collaboration across the whole system. So these are our public health priorities, and importantly for today, with more of a focus on diet and healthy weight, priority 6 really asks us to focus on achieving a Scotland where we eat well, have a healthy weight and are physically active. So that is recognised as one of the 6 priorities if we're going to have an impact on reducing health inequalities and improving health overall. So I'll touch briefly now, I'm not as familiar with this, so if anyone has any pressing questions about the national policy landscape, there are colleagues in the room who this is their day job, so they can answer those. So a bit about, I guess, the challenge that we face around diet and healthy weight. So currently about 2/3 of adults in Scotland are overweight, and we know that you're more likely to suffer from obesity if you live in one of our more deprived communities. Currently, diet is the 2nd major contributing factor to death and disability in Scotland, behind smoking. And we know that the diets of most children in Scotland are still high in foods that are high in fat and salt and sugar, and so like about between a half and a third of children report daily consumption of those types of foods. So there is a national delivery plan that was published last year, and its vision is a Scotland where everyone eats well and has a healthy weight. And it has some, quite promising ambitions in this, to have childhood obesity by 2030 and to significantly reduce health inequalities related to diet and weight. Some of the key outcomes mirror the public health priorities, so a focus on children and early years, a focus on improving the food environment, a focus on improving the access to effective weight management services, a focus on kind of gaining stronger leadership across all sectors to deliver against the outcomes, and again that focus on reducing inequalities. And this is a bit of a progress in terms of nationally, so that there's recognition that there are many levers that sit nationally but also at a UK level, and so kind of about a year and a half into the delivery plan, there is an ongoing consultation with ministers about introducing a bill to restrict the promotion of some of the unhealthiest foods. Food Standards Scotland have been consulting on what actions we might take to focus on the out-of-home environment. And there's also new standards for healthy weight services for children and adults that are getting developed and implemented. And some additional investment focused on type 2 diabetes prevention, and importantly for today, this commitment to work with some early adopters of this whole system approach at a local level, with a strong focus on prevention. So why are we talking about systems? And this is a question I've been asked quite a lot in the last couple of months. And for me, it's because when we think about all of those 6 public health priorities, they all represent different complex challenges, and we use the language of complexity quite specifically because of what we actually, the literature behind complex theory and adaptive complex problems really chimes with how we understand some of these challenges. So when you think about a complex challenge, we think about that there's no single cause. So there's no single cause of the levels of obesity in Scotland. In fact, those outcomes are actually due to a complex web of interacting factors that no one organisation or agency has control over all of it. They're also really unpredictable, so we don't know how that system is going to evolve and adapt over time, and importantly, we don't know how it's going to respond to any of the actions that we take locally or nationally to try and reshape the system. And so if you think about obesity specifically, and those in the room, again, who work in and around diet and obesity will be really familiar, probably will get a sore head when I put this up. So this is the foresight map that a bunch of public health experts developed for the UK government a number of years ago. And really all I want to say from that is that's a visual representation of that complex system that is driving obesity. There are over 100 different factors, and they're all interconnected in a complex relationships, and that changes over time as well. And what's important for us is that when you start to group some of these factors at a kind of higher level, so it begins to speak to, I guess, how the drivers of obesity sit well beyond healthcare provision. And so healthcare really just covers the blue blob there on the bottom right hand side. But then you can see there are macroeconomic drivers, education, early years experiences, food production and supply. So what it tells us is that the health service alone is not going to have any impact in terms of reducing obesity. So we need to work collectively across all elements of this system to try and shift it and improve outcomes for our communities. So how do you respond to a complex challenge? And this is really where the whole system approach, the public health reform has been developing with partners, comes from. So our whole systems approach is really intended to help us meet the challenge appropriately so that we don't try and take or develop simple solutions to a problem as complex as this. So we're not setting ourselves up with the easy solution, but actually isn't going to make a difference. It helps us to draw on multiple perspectives to get a really clear, holistic understanding of this wider system that's driving this outcome, and really helps us to see that bigger picture. It's intended to support our actions so that we're not just trying to manage the demand on our services, so not just trying to manage the demand on our weight management services, but trying to actually move a bit more upstream and try to reduce that demand. So sometimes people talk in public health about, they use that idea of pulling people out of the river at the bottom, but actually if we just keep doing that, we're not lifting our head up and trying to understand why are people falling into the river and why are we constantly at the bottom trying to pull them out and rescue them. So it's about trying to get us to shift our thinking and our actions a bit more upstream. It's also intended to try and align our efforts to strengthen our impact and support and strengthen collaboration, local and nationally. And importantly, it tries to put learning at the heart of what we do. And so at the beginning of this year, Reform had a series of engagement events, mostly locally, but also with national partners, where we took some of the learning that was emerging from England with Leeds Beckett, and also from other kind of international examples of where they're beginning to try and apply systems change approaches to social policy. And we had a series of discussions across the country about what does this mean in Scotland? What do we think has prevented us from working in this way to to really contribute to changing those outcomes for public health. And through that we came up with this set of 9 characteristics, and we were quite purposeful in saying that we don't want to develop a toolkit, because this is really a focus on how we work, and there are lots of toolkits out there that I think people can dip into, and the Leeds Beckett Public Health England one is one that we would definitely recommend people look at. But our whole systems approach then really, it focuses on these characteristics are intended to support that kind of gaining that shared understanding about what the challenge is that we're trying to address. Importantly, widening the perspectives that we bring in to gain that shared understanding, so making sure that communities and those who experience the poorest outcomes are involved through this work. It's also intended to strengthen, so there's lots of great collaboration that already happens across Scotland, but it's intended to challenge and strengthen that, so that we're stepping up a bit and saying we could do more, and the review of public health definitely told us that we could do more. And it focuses in particular around the type of leadership that is required to do this type of work, and that is the leadership that recognises the collective endeavour needed. It reaches beyond organisational boundaries and focuses on what's important for communities rather than just the priorities of individual organisations. And importantly, it thinks about what are the things that we need to put in place that will sustain that collaboration. And so when we went out and spoke around the country, they often talked about, you maybe got really good collaboration on a public health strategy for about 12 months, 2 years, and then there's a natural kind of drop off that happens where your local partners have disengaged and other priorities have emerged. So we're really interested in understanding how will this approach sustain that collective endeavour over a longer period of time. Thinking about how we align organisational outcomes to support that, how do we resource this work in a way that supports it, and how do we ensure that we embed a learning culture in it as well. So if you're responding to a complex challenge, as I said, these complex systems adapt and evolve over time in response to what you do, but also in response to the wider environment. So at the heart of any efforts to change a system, you need to make sure that you're embedding robust monitor and evaluation and an ability to learn and adapt and evolve to sustain your positive impacts over time. So one way that we are further developing this approach, so I would say this is where we're at now, and I expect this to evolve in the next 2 years with your help and the help of our early adopters. But to kind of try and accelerate that learning a bit, we are identifying and working more closely alongside what we're terming early adopters. And these are really local or national partnerships who are interested in adopting and testing out and further developing this way of working. And more importantly, I maybe would rephrase them not as early adopters now, but they are like learning partners for us, because they're going to actually implement this and they're willing to step up and share what works, what doesn't work, both with us and with other partners across Scotland. And so you'll probably, if you follow any of the Public Health Reform social media accounts, you'll see that we've got some early adopters in the room today actually. I'll not single you out, but we are beginning to identify, and a lot of them are quite early stages of their journey, but I hope over the next 2 years that we'll be in a position to start sharing some of that learning at events like this and through other means as well. But today is more about the wider system who are not being identified as early adopters, and trying to equip you with some of the skills and confidence to take some of this work and begin to apply it in your local systems. So before I hand over to Leeds Beckett, I was asked, and I forgot at the beginning, we were in North Ayrshire yesterday launching one of our early adopters focused on diet and healthy weight. And what was really useful actually was doing a round of introductions to get a sense of who was in the room. And North Ayrshire did a great job of reaching far and wide across their local system. I was really impressed. The people they got in the room, it was not the usual suspects. They had environmental health officers there, they had colleagues from planning, from licensing, from economic development, I think I heard as well as kind of, I guess, services you would expect to be there, like education, the early years team. And so I've not really been keeping an eye on who signed up today, but I'd be really interested just to get a sense of who you are and where you're from. So even if it's just your job title or the bit of the country that you come from, I'd really welcome, and Leeds Beckett would welcome just getting that sense before they pick up where I've left off. So maybe just start